Anyone can suffer from it. People who are active, sedentary, young or old. Heel pain can really take over a person's life. In today's MedWatch report, Michelle Dunaway shows us that the treatment for most cases is simple and painless.
Going between patient rooms a lot and talking to my staff, and I find that it's more efficient for me basically to be on my feet and working on my feet.
Efficient, yes. Comfortable, not always. Dr. Michael Carroll was having serious foot pain.
I was actually getting aching pain almost all the time in my foot by the time I had this condition for really several months.
As a doctor, he did what he knew, tried to take care of the problem.
The things that I was doing, such as stretching and icing, and I was wearing a posterior splint on my lower leg when I went to bed at night, these things simply were not getting the job done.
So he went to someone who could, podiatrist Dr Jeynes.
There's a number of different ways you can treat heel pain. The root of the problem is you need to get to the biomechanics, is what we try to get to, the biomechanics of what is causing the problem.
Dr. Jeynes says the problem is typically inflammation, either bursitis or plantar fasciitis, sometimes caused by heel spurs.
I will say I did have the diagnosis right. It was plantar fasciitis, and he gave me essentially a new way of thinking about it, and a new way, and that led to a new treatment plan.
As a chronic inflammatory problem, you continue walking on your foot, it overuses or overexerts the soft tissue in there, and just perpetuates itself and gets worse.
It's not too realistic to expect anyone to stay off their feet, so Dr. Jeynes relies on another solution.
I like to use and really strongly believe in controlling the mechanics of the foot with an orthotic. There's thousands of over-the-counter inserts, orthotics. It's hard to say what works the best. Everybody's foot is a little different.
Really, is what this does is essentially put your body in a position where it can heal itself, and therefore, the symptoms went away.
Now Dr. Carroll is walking around the office pain-free with a new perspective.
Certainly, it gives me an understanding of how chronic pain can affect someone's life.
For 9 and 10 News MedWatch, I'm Michelle Dunaway.
And other more aggressive treatments for the foot pain can include casting the foot or even surgery.